I'm Dr. Shabaz Ahmed. I'm a consultant in care of the elderly. So I get a full range of patients that admitted to this care of the elderly dementia-friendly ward. So we get all grades of frail patients admitted with dementia, stroke, COPD, heart problems, chest problems. I think it's having ready access to the information. That can be a problem sometimes, especially when the patient is a new admission and the full folder of notes have not followed the patient, and the patient may have been seen by, say, the palliative specialist nurses in the community, or may have had ceiling of care or advanced directives made in the community that may not be readily available to us here in the hospital. And sometimes the patient may have had other appointments in other hospitals. For example, today I came across a patient who was seen in gastroenterology department in Manchester Royal Infirmary Hospital. I really need to know the outcome of that. I had no access to that information, and it may take again 2 or 3 days before we get any information from another hospital, because we have to ring their department in that hospital and trying to get the secretaries or medical records to send us something. Yeah, it's very frustrating because you cannot make decisions on the shop floor on the same day, because you have to wait for information. Yeah, I think you'd be surprised a considerable time actually. I finished my ward run today at about 12, and at least about an hour was spent, chasing investigations, and going into the Lorenzo systems and trying to get information. Yeah, so obviously we'll have a look at the actual the clerking note, see how much information has been entered there. Sometimes there may not be enough information because patients may be confused, dementia may not have given much information. We may get a good GP letter, but sometimes we may not get a GP letter, especially if the patient has been admitted to emergency department. Sometimes we have to ring up the GP in practice to get some information. Certainly the pharmacists, for example, they ring up general practice quite often to get their medication list, which is of help to us. When I learned about it, it's quite exciting because it's the time to come, isn't it? Having the local healthcare records, so you'll be able to access information when patients visit other hospitals or seen by the GP. We have all the information from the multidisciplinary team setting. So I think that is the way forward. But I understand obviously there are challenges to get it right. But I think if we can have that information readily accessible, say on the ward round on the same day, then that will speed up patient assessments, that will speed up patient flow, and that is likely to impact on length of stay. I think it should reduce the length of stay, because the delays due to lack of information or delays due to chasing other departments or waiting for their response, that should reduce. So therefore the length of stay should reduce, and therefore the patient flow should increase. So that should be positive on the whole healthcare economy.